Hey, we're on your side today with some health news. January is Cervical Cancer Awareness Month, and in this week's Ask the Doctor segment, sponsored by National University, Dr. Dave joins us to talk about awareness and prevention. And this is a cancer that is preventable.
That's right, Mike and Jenny. Good afternoon.
Hi.
12,000 women every year are diagnosed with cervical cancer, and 4,000 women die from the disease. Cervical cancer is caused by a common virus called human papillomavirus, or HPV, and HPV infects cervical cells and can transform them into cancer over time.
We've all heard about the HPV vaccine.
That's right. That's right. Cervical cancer is preventable with the vaccine, screening tests, good follow-up care, and healthy habits. So there are 5 things that women need to be aware of. The first is to get the HPV vaccine. If you are 26 or younger, you can get the vaccine, and it is recommended in boys and girls starting at age 11 to prevent cervical cancer, genital warts, and cancers of the anus. The second is to get the Pap test to screen for abnormal cervical cells. It is recommended starting at age 21 every 2 years, and for women in their 30s every 3 years. The third is to get the HPV test if it is recommended by your doctor. It is given to women in their 30s in combination with the Pap test and in certain women that are younger or older. The fourth is to keep your doctor's appointments. Most women who have abnormal Pap tests or positive HPV tests do not get cervical cancer so long as they follow their doctor's recommendations for future tests and treatments. So mark your calendar and not forget your doctor's appointments. And the fifth is to not smoke. Smoking harms cervical cells, and the combination of smoke and HPV increases your risk of developing cervical cancer. So if you are a smoker, talk to your doctor about steps to help you quit.
I think keeping your medical appointments is just a common sense good thing to do anyway, right? Absolutely,
especially with something like this where you're relying on the test to make decisions.
Okay, so you're okay with the vaccine? You have no problems with it?
It's controversial to some people, but you would...
It's been tested, and it is now recommended by many leading medical groups to routinely give it to boys and girls.
And boys can spread HPV, right?
HPV is common in young men and women who are sexually active.
All right, okay. Dr. Dave, thank you so much.
You're welcome.
All right, our Ask the Doctor segment, sponsored by National University. You can see it every Tuesday right here on CBS 47 at noon. If you have a question or a topic idea for Dr. Dave, just email it to us at newsdesk@cbs47.tv. We'll be right back.